favorite radio station. This is AfroVibes Radio Houston.
Hello, listeners around the world. You are now listening to AfroVibes Radio, broadcasting to you from Houston, Texas, and you are tuned into Medicine for the People. I am your host, Dr. Susan Edionwe. Thank you for joining me. If you are driving home, I hope you have a lovely drive. If you're in your office and you are listening to the show, put the radio under the desk so your boss does not see you. But either way, turn up the volume and let's get ready to talk. Today's show, I'm going to be speaking to you all a little bit off the cuff. One of the things that I am very passionate about when I think about being a doctor is I like to educate people. And I love it when I have patients who really digest the information that I'm giving them. And so what we're going to be discussing today is how to get the most out of your doctor's visits. The reason why I want to talk about this is because a couple of times this week, last week, actually several times in the last few months, when I have new patients come to my office, I like to make sure each patient knows exactly what I'm doing, why I'm doing it, the things I'm considering. And so I do a lot of talking, a lot of educating. And many times patients have said to me, this is more information than anybody has ever given me regarding this issue. On one hand, I'm happy because I can give them the information that they need. But on the other hand, I say to myself, physicians, we need to do a better job educating our patients, and patients need to be empowered to get more out of their doctor's visits, to get more information. Now, everybody's different. Doctor or not doctor, we are different people. In my real life, as you can probably tell from my voice and my voice inflection and the fact that I like to talk, I am very talkative when it comes to something I know a lot about or when it comes to something that I'm very passionate about. So you will catch me talking all day. But that's not the case for everybody. There are people who are more reserved. There are people who are less talkative. And so when you're going to see your doctor, if your doctor is not necessarily the most talkative of people, this is your opportunity to really capitalize on the visit. One of the things I just do not like is when I have a patient who comes back and they weren't compliant with the plan that we had discussed the month before or the weeks before because they didn't understand why they were given the medication they were given or what it was supposed to treat or what would happen if they didn't take it or what happens if they don't take the medication consistently. And so when they come back, we go through the questions. Did you do this? Did you do that? Yes, I did. No, I didn't. I didn't do it every day. And it's a waste of time. Not necessarily for me, but it's a waste of time for you as the patient. Because if you would have understood, no, this is what I needed you to do. This is how often I needed you to do it. If that education was clear, you as a patient would be more empowered to do everything that you need to do and do it as diligently and as consistently as possible so we can keep the wheel churning on getting you to a healthier place. So part of this show, in terms of equipping you with knowing what to ask your doctor, is explaining to you all how we as doctors think. One of the things that a medical student, somebody early on in training, is taught to do is come up with what we call a differential diagnosis. That means a list of 3, 4, maybe 5 things that could be the diagnosis for what you have. Now, there are certain conditions where you go to your provider and it's a chip shot. Every symptom you have 100% fits a single diagnosis. There's no questions. There's no guessing. The answer is simple. And your doctor will put you on the medication. They're treating you for one thing. but that's not always the case. I'll give you an example. As a head and neck doctor, I get a lot of people who will come to me with chronic cough. So chronic cough, meaning a cough that you've had for more than 6 months, can be multiple things. It can be, in fact, one of 4 things. It can be due to blood pressure medication. A certain type of blood medication known as an ACE inhibitor has been known to cause cough. It can be due to your allergies. When folks have allergies that aren't controlled, especially with the nasal drainage, the runny nose and the postnasal drainage, that drainage can land on your throat and cause cough. It can be due to asthma. Asthma doesn't just come on in childhood. There is adult onset asthma as well. And adult onset asthma sometimes presents only as a cough. The last thing that it can be due to is silent reflux. And the reason why this condition is one that I see a lot is because silent reflux, one of the reasons why it's known as silent reflux is folks who have this condition, they come with something, a sensation of something being stuck in their throat. They're always clearing their throat. They may have some throat mucus. They may have a bitter taste in their mouth in the morning. They may have some shortness of breath type of issues and feel like it's asthma. When these folks come to see me, the answer isn't always simple. There is a process, and in my head, I'm thinking, well, it can be one of these 4 things. So I ask my questions, and I may narrow it down to 2 things. That's not the only condition that presents like that. A lot of medical problems, the symptoms can fit multiple diagnoses. So as a physician, we're thinking of our differential diagnosis in our head. And once we have a list of things that your symptoms could possibly fit, then we start ordering tests or putting you on different medications. With the chronic cough example, if I feel somebody has allergies as well as silent reflux, well, then I'm going to put you on 2 types of medications, and they're not going to do the same thing. If I don't explain to you, you have this nasal spray because of your allergies and any drainage that's causing your throat irritation, and then I'm putting you on these reflux medication pills to treat any silent reflux. If I don't explain that to you, you will go home and you may think the pills are supposed to stop your cough and the nasal spray you may not need to use. And you may not, or you may use things incompletely or inappropriately. And when you come back to see me, I'll say, well, why didn't you use this? And the answer is, well, I didn't really know. So when I have patients come in, especially patients who have symptoms that may fit more than one thing, as all doctors, a list of things are going on in my head. And part of making sure that you're compliant with the plan, I like to explain to you, well, these are the possible things it can be. And when I do that, I find patients are very receptive to getting more than one medication, because a lot of times if we're thinking it's more than one thing, it may be appropriate to put you on many things. But it decreases frustration and confusion for the patient when they understand what I'm doing. Now, if you are seeing your doctor and you have a condition, it's important for you to know, are you treating me for one thing? Are you treating me for many things? Because of what I have just explained to you. You shouldn't be leaving your doctor's office without knowing what condition or conditions are being considered and are being treated. Not only that, you should leave knowing that your symptoms fit that condition, knowing what causes that condition, so you can understand exactly why your throat feels like there's something stuck in it, or where the drainage is coming from. Educating yourself, even after leaving the doctor's office, gives you insight into so much in regards to how long you're going to have this issue, or what the prognosis, meaning what the future or the outcome of this problem can be. After our commercial break, I will speak to you all more about how to get the most out of your doctor's visit. But for now, stay tuned for our commercial.
Hey, bro, what's good? What's going on?
Yo, nothing much, fam. Have you heard about AfroVibes Radio?
Nah, bro, what's that? How do I tune in?
It's the #1 online radio station. You can listen online or in TuneIn Radio, Google Play, Zia Live, and iTunes. Definitely check it out.
Ah, nice. I'm definitely going to tune in and keep it live. Let's get it.
Definitely.
We are back from our commercial break. You are listening to Medicine for the People. I'm your host, Dr. Susan Edionwe. And before the break, I was discussing with you why it's important to know the condition or the conditions that your physician is trying to treat, because that helps you with insight. It helps you stick to the plan. Now, one of the things I will say that I find very interesting is there is a cultural predilection in some people to not question the doctor. Case in point, people from the continent of Asia. There is a very strong and high esteem for authority, especially for physicians. And one of the things I find quite often is said to me by my patients who come from Asian countries is, you're the doctor, I'll do whatever you say. And as a doctor, on one hand, this is music to my ears, right? Because I just want you to do what I think will make you feel better. But at the same time, as somebody who's trying to educate you, as somebody who is trying to get you better, as somebody who has been trained in the field of medicine, we know that when patients understand what we're doing and why we're doing it, the compliance is so much higher. And when you're more compliant with the plan, you save yourself money, you save yourself time, and it helps me work through the process of what we do next. For example, if I'm thinking maybe there are 3 possible things wrong with you, and I decide to start by treating the most likely of the 3, if you understand that, I'm thinking there may be 3 things, but let us start by treating this first thing. What are your expectations? Your expectations are what she's putting me on may work. I need to be very diligent with what she's giving me, because when I come back, we're going to review my symptoms. We're going to see if anything is improved. And then if it hasn't, we'll go on to the next treatment for the second condition she's considering. So you can see how your compliance will save us time, will help keep your medical care going, versus if you came to me and you didn't understand that I was considering one of 3 possible things and you didn't really do the first thing efficiently or consistently. And so now we got to go backwards. I have to explain to you, well, I really wanted you to be consistent for this reason, and I can't move on to the next treatment until you actually do the first treatment appropriately. And do not feel that your physician is going to take any kind of offense to you asking questions, especially when we know that you are interested. Most physicians welcome your questions because we know how important it is for you to buy into the plan. If you have a physician that's making you feel, for lack of a better word, stupid for asking a question, that to me is a big problem and a red flag, because that is the language that's communicating to the patient, I don't really care if you know what I'm doing or why I'm doing it, just do what I say. And I don't like that kind of medicine, and you shouldn't accept that kind of medicine. So it is important to know why we're doing what we're doing. The other thing that is also very important when you are at a doctor's office, you're going to be given medications. You need to know what each medication is designed to treat. Like I said, going back to the chronic cough issue, if I'm going to put you on a reflux medication and an allergy medication, I want you to know that the nasal spray I gave you is for the allergies and that the reflux medication is for the heartburn issue. If you are leaving your doctor's office with more than one medication, ask what each medication is supposed to do for you. The other thing is, part of getting better when you have a condition, especially your less serious conditions, these are conditions that aren't cancers or conditions that won't kill you, there's not a high risk of death. But for most conditions, there are other things that you can be doing at home. With your allergies, for example, when we're treating your allergies, it's not just the medication I give you. I want you to avoid the things that you're allergic to and to prepare for exposure to things you're allergic to. If you're allergic to grass is going to make your nose run. It's going to make you very congested, but then you have to cut the grass at home. Well, then I want you to pre-medicate, take an allergy pill before you cut the grass, and as soon as you come back, I want you to rinse your nose with a saline rinse to clear any kind of grass pollens out of your nose. So these are things that you can be doing to help me make you better. So ask your doctor if there are other things that you can do or what he or she expects you to do while you're at home, aside from just taking the medication. I'll give you an example that, really struck me as to why I feel this is important. I, here in Houston, work with the Nigerian Physicians Association. It's called the Association of Nigerian Physicians in the Americas. And we went to a volunteer event where we were screening folks with blood pressure. I had a Nigerian patient who's very prominent here in the Houston community who's had blood pressure for years. Nobody told him, his providers never told him that high blood pressure is linked with his diet. It wasn't until we sat him down and said, your high salt intake is making your blood pressure control worse. And he was shocked. This is the first time he heard it. Now that he's heard it, he's and his family have implemented big diet changes. So you can see how figuring out what things you can do at home can help you make yourself better. We're about to cut to another commercial break, but when we come back from the commercial break, I want to continue to speak to you about how you can make the most of your doctor's visits. So, as always, turn up the volume, sit tight, and stay tuned for more of the show.
We're giving you the best on AfroVibes Radio. We are 24/7, so don't change that dial. Just leave it on.
Welcome back to our show. You're listening to Medicine for the People. With me, Dr. Susan Edionwe. Before we went on commercial break, I was discussing with you all the kinds of things I am thinking about as a doctor. And, because I am somebody who, like I said, I love to talk to patients. I love to educate my patients. I tend to be very forthcoming with a lot of this information, even before the patient can get a question out of their mouth, because I know what patients are thinking. But what if you have a provider that isn't as forthcoming? Well, central to everything I am telling you, and the take-home point really with everything I'm saying to you, is you have to ask questions. You have to ask questions. You should not leave your doctor's appointment without getting the information that I've spoken to you all previously. So what I've done to make it easy for those of you who say, well, what kind of questions do I ask? I have compiled what I like to call Dr. E's list of important patient questions. The first question, what conditions are you treating? That goes back to what we talked about earlier in the show. Are we just treating one condition, or are you thinking that there are multiple conditions at play here? Ask those questions. And when you get the answer for the condition, don't just settle on the name. Ask a little bit more. Do the symptoms I have, does it fit with this condition? The other question you should ask is, what does each medication do for me? What is it treating? Again, going back to what we discussed earlier in the show, if you walk away with 4 different kinds of medications, and I will tell you, there are certain instances where I will have a patient who comes in with a really bad sinus infection and they leave my office with 3 to 4 different kinds of medications. And I know that it's hard to take medications. And on top of it, you're not just taking one, you're having to take multiple, and you're having to remember to take it anywhere from 1 to 3 times a day. I break it down into This medication is for the infection in your sinuses. This medication is for your allergies. This medication is for so on and so forth. So they know what each medication is designed to do. When you're asking about the medications, also ask about side effects. Should I expect certain side effects? With certain infections, you may be given steroids. Steroids can, if you have diabetes, it can make your blood sugars worse. It can also make your heartburn worse. So you need to know the main side effects for the things you're being put on. The other question is, what other things should I be doing to get better? Going back to the example of the gentleman that I spoke about before we went on the break, if you have high blood pressure, you should be doing a low salt diet. You should be eating lots of green leafy vegetables. Research has shown that this type of a diet helps with controlling your blood pressure. So whatever your condition may be, ask your doctor, what other things should I be doing aside from taking the medication to make myself get better? The other question I like to tell my patients, and I want you to ask your doctor, is how soon should I see a change? Not a lot of people ask me this question. I voluntarily give this information, but this is a question that I think would really empower a lot of patients if they knew how long they're expected to be on the medication they're being given. Going back to the example of the silent reflux that I started earlier in the show, silent reflux, you could be on reflux medications anywhere from 4 to 6, and in some people with really bad disease, maybe even 9 months. So if I put you on this type of a medication and I don't tell you, hey, this isn't going to be quick, in 2 months, you probably won't feel much of a difference. If I don't tell you that, you may stop using the medication after 1 week. I see that a lot. Patients will come to my office and say, oh, this doctor put me on this, but it didn't work. And then I have to tell them, by the way, that medication doesn't actually start to work until you've used it for 3 weeks. And here you have somebody who only used the medication for a week. So that is very important. How soon should I see a change with the treatment that you're giving me? Lastly, what happens if this doesn't work? You need to know what the plan is afterwards. Going back to what I discussed with you, where as doctors, we've got multiple things in our brain. When you're talking to us and you're saying, well, this hurts, and that hurts. It started about the same time. This other thing also came about the same time. We're building a list of possibilities. If I treat you for the first thing on my list and that doesn't work, I already in the back of my head have at least another thing I can try. So ask your doctor, what happens if this treatment doesn't work? We all have been trained to think far ahead enough that we can tell you what the next steps will be if your medication works or if it doesn't work. Lastly, I wanted to touch on people who are having surgery. As a surgeon, I do a lot of educating when it comes to surgery. If you are having surgery, the list of questions you have to ask are many more. You need to know the risks and the benefits of the surgery. What kind of pain should you expect from the surgery? How much time off of school or work do you need to plan for? And how soon after surgery should you see an improvement? Not all surgeries do you get an immediate improvement. Sinus surgery, I tell people, it's not going to be immediate. There will be a healing period before we really see the benefits that we get from surgery. So I hope this show helped you to understand what we as doctors think when we speak to you. And I hope it also empowered you to ask questions and to know what kinds of questions to ask. You should walk away from your doctor's visits knowing what you are being treated for, knowing what things you can do to help improve your outcomes, and then knowing what the next steps are afterwards if you don't get better. That's all the time we have for today's show. As always, like us, follow us, get plugged into the AfroVibes Radio community. Follow us on Facebook at AfroVibes Radio. Follow us on Instagram at AfroVibes Radio, and also check us out on Twitter at AfroVibes Radios with an S, and follow me on Facebook. Medicine for the People. I want to hear from you. Ask me your questions. Send me your message. Tell me what things you want to talk about. And maybe next time we'll talk about something you would like to hear. That's all for our show today, folks. As always, stay healthy and stay informed.
This is your #1 radio station. Tune in and rip the knob off.